for symptoms. It is highly effective. So currently, what is recommended in asthma management is that when patients come, ask them questions. How frequent are your symptoms? If the symptoms are not very frequent, then you put them on a kind of treatment that is called AIR. AIR is AIR. It stands for anti-inflammatory relief. But if the patient has frequent symptoms almost every day, then you put them on the SMART Dr. Bankwa talked about. The difference between the AIR and the SMART is that with the AIR, it is for those who have infrequent symptoms. So what you do is that you give them formoterol budesonide, or like Symbicort, and you tell them that this one, you don't need to use it every day. But whenever you have symptoms, then you use it, the daily Symbicort. And then in addition to that, you tell them that when you have symptoms, you should also take additional doses of the Symbicort. So you are using only one drug, both as a controller and as a reliever. Unlike in the past where we would give them the Symbicort and then you give them salbutamol. These days I still see it at my clinic where a patient has been prescribed salbutamol inhaler. And in addition to that, when you have the symptoms, patient on the AIR, where they use the Symbicort as and when, you have to assess their mobility. Also, the AIR doesn't apply to a patient who just had an attack. Somebody has had an attack and he has come to you. Then he tells you that, oh, this attack, right, this was like free. Then I'll step you down to the Symbicort as and when. So we have to be very careful not to put the wrong patient on the as and when usage. So this is how to run a SABA-free clinic. So you put a patient on formoterol budesonide. It is used for patients who, this one, let's pay attention. It is for patients who are 6 years to, adulthood. Children who are less than 6 years, we do not give them Symbicort or formoterol budesonide. Those children, you put them on salbutamol and then a plain corticosteroid. So for our children less than 6 years, you put them on salbutamol. Salbutamol is not suddenly a devil. It's there. The fact is that they tell you
and benefit of the table healer. And to do us the honors, let's please welcome Madam Dorothy Letitia Arthur. Please put your hands together for her.
So good afternoon to everyone. My name is Dorothy Letitia Arthur, and I'm a medical rep from AstraZeneca. And I'm very grateful to Trust Hospital for this pleasant opportunity. So over the years, AstraZeneca has always been a pioneer in the asthma space. So for some years now, we've been partnering with facilities like an occasion like this, and we've been also having training sessions for our prescribers, nurses, staff, and staffs of hospitals to be able to curb or get to a zero mortality for asthma. We want to get to a place whereby we are not going to have any mortality for our asthma patients. And with this, what will we benefit from it if we do all this and our drug is not accessible to our patients who, for no fault of theirs, are asthmatic? So one of the main projects we did was the PUMWA project. And in this project, insurance, so that patients, even in the remote areas, can also have access to it if they have the national health insurance. And with this too, we were able to set up nebulization stations for hospitals. And Trust Hospital is also a beneficiary of one, so that we'll be able to help these patients reduce the asthma exacerbations. So we realized that over the years, patients were being put on our oral corticosteroids, and This also had its own side effects that comes with it, whereby you have the fluid retention, you have the weight gain, the increased appetite, and the others. And also, if a patient is hypertensive, you are adding on asthma medications to that of the patient, whereby you are going to increase the health-related cost of these patients. So, there is exacerbation. AstraZeneca brought up a medication by name Pulmicort, which contains budesonide. So, for our emergency setting, Pulmicort to now do your Hydrocort IV, to be able to administer, to be able to curb the exacerbation or the distress they are in. You are already going there to nebulize your patients with salbutamol. So you add your Pulmicort to your salbutamol. If there's a need for you to add your ipratropium bromide, you add that and you nebulize. This is the simplest way and the fastest way you can make these asthmatics better earlier. Then our Pulmicort also comes in the 0.25 milligram strength, and we have the 0.5. So we recommend the 0.25 for the kids and the 0.5 for the adults. Now we are making inhaled steroids or inhaled treatments accessible to all. So this is one of the medications we have to make it accessible to all. Then thereafter, Dr. Stildazi has said a lot. There's no need for you to let the patients go home without any medication. So as we are done with the hospital setting, when they are going home, we continue with the same medication in the house. So we also introduce Symbicort. And now Symbicort is the #1 premier drug we have on the market. And it is the innovator and an award-winning product as well. So our Symbicort contains our budesonide formoterol. And we've realized that formoterol works as fast as SABA, just that it's a long-acting beta-2 agonist. So it stays in your system to work better for the patient as well. And this is also recognized globally, whereby the Global Initiative for Asthma, and in Ghana here, the Ghana Thoracic Society have approved ICS formoterol, that is Symbicort, for use as a maintenance and also a reliever therapy. So there's no need for you to put patients on 2 different inhalers. Symbicort alone will do the work for you. So Symbicort gives you a better asthma control with 1 inhaler and a low ICS dose as well. So Symbicort comes in 2 strengths. We have the 84.5 for your kids from 6 to 11 years. Then we have the 164.5 for 12 years and above. And one good thing we've done so far is that Symbicort is available on NHIS for places whereby they take the NHIS insurance. It is accessible. That is the 164.5. You get it free. So most of these government institutions have it installed there. Our Symbicort is a dry powder inhaler. So you realize that you have patients coming in to tell you that I've taken in the medication, but I don't feel anything. Yes, you won't feel anything because it comes in 1 to 5 small particles, microns, small particles. So you're not going to taste it in your mouth. And you take the drug, it goes directly to the site of action. We are trying to curb a situation whereby you feel the drug in your mouth and you have minimal going to where it is actually needed. That is why with our Symbicort, you are not going to taste the drug in your mouth to be able to deliver every single particle to the site of action. Our Symbicort is very easy to use for any patient that comes in. Dr. Steele has already said that it is very necessary to make sure the patient is using the correct inhaler technique or the practice. So with every patient, we should make sure we assess how the patient is using the medication. So with this platform, I'm going to teach all of us how to use the Symbicort medication as well, so that wherever you find yourself, whenever you have a patient, when he tells you, how do I use this product, you'll be able to teach the patient how to use. So with this, I invite my colleague, Amos Achu, to help me with the demonstration of the device as well. All right, so what we are using now is a dummy. So you won't see this as a product that is being served to patients. So we want you to appreciate the features of the Symbicort. So when you take the cap off first, just as he's doing, so we take the cap off. We have three main features. We have three main features of the Symbicort table inhaler. We have the mouthpiece. Please, I'm very passionate about this because when we say inhaler, some patients think it is for the nose because we have inhalers for nose. So instead of putting it in the mouth, they tend to put it in the nose to inhale. No, Symbicort is for the mouth and mouth only. Then we have the second part, which is the dose window or the dose indicator. It shows you how many doses you've taken at a particular point. So after you've twist and click the red grip 20 times, you see a quant grip. That is where you are going to twist and click to be able to release a dose for your patients so that they can inhale. Now, with our pharmacy staff and our doctors, I always appreciate Grace because she's been very helpful with patients on how to show them how to use the Symbicort inhaler. We have something we call activation or priming. So when you buy a new watch, you have to set the watch. The same with the device. You have to set the device so that every patient will be able to use it as well. So we are plead go. It will be very easy for them to watch. So to set the device, you twist it in one direction till you hear the click. Now with the Symbicort, every time you hear a click after the first click, when it is new, it means the device is ready to use. So after you've activated the device and heard the click, now you are going to twist in the opposite direction and twist back till you hear the click. That's it. That means your device is ready to use. So whenever you hear the click sound, I wish I can take the microphone closer so that they will hear the click sound. I don't know if you heard the click. So when you hear the click sound, that means the device is ready to use. Now, we ask patients to breathe out first. Breathing out is just going to open the lung so that when you pull in the drug, it will be able to settle at the right place. So you breathe out, then you put the inhaler in your mouth. Please, I'm stressing on the mouth. You wrap your lips around it, then you pull. You don't need a lot of effort. So far as you are able to pull from a straw, the same effort you need to be able to pull from the table inhaler. So you just pull, you take it from your mouth, you count 1 to 5 seconds. Then you exhale. If you have to take it again, you twist, you click,